Residents from Graaff Reinet and surrounding areas fill up the Botanic Sports Club in Graaff Reinet to have their health challenges and grievances heard. Officials from the Health Department Portfolio Committee listened intently to issues about the urgent shortage of medical staff, medicines and ambulances in the region.
The shortage of medicines at the clinic. You are going to the clinic and then you are told to come back next week because the medicine has not arrived yet. Our people are being to me, it's like they're being ill-treated, which is not right, and their health is deteriorating. So I would please ask for you to do, what is this now? Please do justice to it. Please see that it's foreseen. Thank you very much.
Residents were also concerned about ambulances not being able to access certain areas and the lack of facilities for psychiatric patients in the region.
The issue on mental patient is a matter of agency. To a situation where we can't have patients who are admitted, mental patients who are admitted with normal patients, because that is a disaster waiting to happen. We're expecting the report to say resolved because that is a matter of agency.
Challenge that people of Umasizakhe or Graaff Reinet are facing one, it is poor service in attending the patients when the ambulance has been called. Two, there's not enough medication in clinics and hospitals. I think it's been mentioned by previous speakers also. The third one, which is, I think is very important for the people of Umasizakhe, especially in Vrygroen. There's an informal settlement of Vrygroen. Ambulance don't enter Vrygroen. Recently, the ward councillor Nofemela has to rush a young boy who recently died because he drank diesel whatsoever, a poison of substance. So the ambulance not entering that informal settlement, so a special request from the residents of Vrygroen is that for a mobile clinic to be placed there.
MEC of Health Nomakosazana Meth says they are working on fixing the medicine and staff shortages in the area.
I don't know from what to there is a complaint about the shortage of medicines to people who travel 50 to 60 kilometers from Graaff Reinet. We've got an issue, Honorable Speaker, which is a general challenge across the country of shortage of medicines. But that has at least an accepted norm in terms of percentages. And I'm always reported to by my officials the medicines availability in percentages, which may not be enough when we are responding to the communities right now, because in majority of cases, when we say we are at this percentage in terms of medicines availability, that does not talk to a lived experience of a patient or a relative who took a patient to a facility looking for a particular medication and couldn't find that particular medication. We always request that these matters be escalated to our attention using our ward councillors, using our local leadership in municipalities, also contacting our facilities.
In October last year, the MEC announced a 3-phase plan to address key challenges with the Eastern Cape's emergency medical services, including procuring of new ambulances. The plan requires 27 million to implement, which the department is struggling to find.
Because again, the national norm in terms of ambulances, you must have one ambulance to service 10,000 people. With us as the Eastern Cape, we've got one ambulance servicing 20,000 people because of the budget constraints. We are a department or a sector that is also underfunded, but with the many issues of migration, many issues of economic crisis, we find ourselves having to be again affected by the budget cuts.
Many residents were frustrated about the short time allocated to them because they had many more complaints they felt needed to be addressed. The health department has promised to look into all the residents' grievances. For MPK TV News, Lusulwethu Antoni, Graaff Reinet.